This conference will now be recorded.
Thanks for coming, everyone. I appreciate it. Ken asked me to touch on a few things here. One of them was OSHA's NEP for COVID, and then the other things were any directives that we may be working on. So I guess there's a rumor out there that we have a PPE and train directive we're working on. I touched base with our guys in Chicago, and they were not aware of any PPE or crane directive coming out. They are aware of our excavation and trenching directive, a new directive that's supposed to be coming out. They said the new trenching directive is not going to impact employers at all. It's more for our people in the field on how to do proper trench inspections and how to keep themselves safe while they're doing those. So the directive that OSHA is going to be coming out with, they're working on right now for trenching excavation, it's not going to impact employers anyway. It's probably going to, based on prior directives, it's probably going to tell us like when to take soil samples, how to protect ourselves and not get too close to the edge, those types of things. But it shouldn't impact employers at all. So the trench directive is the only thing they're working on. And I think they've solicited some feedback from the different regional offices on that, but not aware of any PPE or crane directive that's being worked on. Now, then there may be somebody working on one in some dark corner of an office somewhere, but if they are, it's probably not going to see the light of day for some time. So having said that, OSHA did come out with a COVID NEP March 12th. And what the NEP is short for National Emphasis Program. And, you know, we finally came out with this after, you know, COVID's been here a year, and now we're coming out with the National Emphasis Program. I got like 15 slides here on the NEP, but the thing to remember is the COVID NEP isn't going to affect construction in any really meaningful way because we haven't seen a lot of problems in the construction trades when it comes to COVID-19. I'm not aware of any COVID-related citations being issued to construction contractors in Region 5. That means that, you know, your industry and the work that you do is such that there hasn't been a lot of outbreaks. People are able to stay social distance for the most part, and wear face coverings. So we haven't seen a lot of fatalities or hospitalizations that are work-related in the construction field in Region 5. Having said that, we'll go on down through here. Construction NAAQS codes are on the list, but it gives the area director a lot of discretion on whether or not to delete those names from the list when they come up, just because we haven't seen a lot of problems in construction, specifically in Ohio. Let me go down to this NEP here real quick. Trying to minimize some of these screens here a little bit too. Okay. So it went into effect March 12th, and it targets establishments that have had an increased potential in COVID-19. Most of these facilities that are going to be on the inspection list for a COVID inspection coming up are going to be healthcare, hospitals, nursing homes, long assisted living, and so forth. There are some industries on there, warehousing, restaurants, and so forth, but not too much related to the construction field. On these inspection lists, establishments with less than 10 employees are on there, okay, because COVID-19 inspections are considered health inspections. I don't know how familiar you guys are with the Appropriations Act, but the Appropriations Act prohibits OSHA from doing a lot of inspection work in certain industries with less than 10 employees. Industries such as auto sales and office environments, things like NAAQS codes that traditionally have had very low injury and illness rates. So every year we get an update to the Appropriations Act. We get an update that lists the NAICS codes that are exempt from OSHA inspections. Now, if we get fatalities or hospitalizations, things like that, we can still inspect, but they're exempt from most OSHA inspections. Now, construction isn't on that list. You guys are fair game for inspections, but some low hazard industries are exempt. And that's what they mean when they talk about the appropriations list. It's just those NAICS codes that we really can't get in and do an inspection on. So these lists that we're gonna put together for conducting what we call programmed inspections, they come from two appendices in the NEP. And a programmed inspection means your company's put on a list. We randomly pull the company name off the list, and we program that for a future inspection. So these programmed inspections are planned. They're planned in advance. They're not some what we call unprogrammed inspections or the other kind. Unprogrammed inspections are ones that come in like complaints, referrals, fatalities, things like that. Things we don't plan for. They just kind of come at us. Those are unprogrammed. So NEP inspections are what we call programmed. We know we're going out to these places. So we have Appendix A. Let me get rid of this. So as you see in these Appendix A, these are the companies that are going to be on our inspection list for COVID. Most of these are healthcare. And these NAICS codes are chosen based on our inspections over the last year. We've seen a lot of inspection activity due to employees becoming exposed to COVID and dying and being hospitalized and so forth. So these are the high hazard industries right here for COVID. And then here's some more. Meat processing. We've all heard on the news and stuff about COVID outbreaks at meat processing facilities out west and so forth. Food processing, warehousing, department stores, supermarkets. These are all industries where you have a lot of people really close together. Restaurants, prisons are on here. We've seen a lot of COVID in prisons. Okay, so this is Appendix A. So when we go out to one of these industries on this inspection list, like let's say it's a nursing home, and they have a staffing agency there, we're allowed to expand that inspection to include the staffing agencies, because we've seen that in a lot of healthcare facilities that staffing agencies are supplying doctors, nurses, dietitians, physical therapists, phlebotomists, hairstylists, it's all over the board for these staffing agencies. And so staffing agency employees are exposed right along next to everybody else. So if they have a staffing agency, we're going to expand. Now, Appendix B, these companies are also put on our COVID list. And you'll see in here, this is where we get into construction trades, construction of buildings, heavy and civil construction, specialty trade contractors. So that's pretty much what you guys are in. So there's certain construction industries that can be put on this inspection list, okay? But here's what the NEP says. It says for certain industries, such as postal service and construction, some of which have had a large number of COVID-19 related complaints, it doesn't say fatalities or hospitalizations, just complaints. The area director should use discretion to determine whether an industry should be considered in generating the list. So as far as I know right now, there probably won't be any construction companies on these NEP lists because we haven't had a lot of problems with COVID in construction on OSHA's side of things as far as hospitalizations and fatalities. So even though construction is in the Appendix B, the area director has the ability to just delete those names off that list, not choose construction sites. Having said that, if we open a construction inspection, let's say due to a fall hazard, we're driving by and we see some folks exposed to falls, or we see, guys down a trench with no box, things we typically stop on. If we stop and perform that excavation or fall protection inspection, and we see employees not working properly according to CDC guidelines, which means we see guys working close together with no face coverings on. We can expand the inspection to cover those those hazards of not following CDC guidelines. So just keep that in mind. When we're on a construction site, we can expand to cover the COVID hazards if we see them. Having said that, we have the ability to issue what we call a notification letter, right? It's when we don't think we want to issue a citation, we can issue what we call a notification letter, and that's just it's a heads up letter is what it is. It's a letter we send to the company saying, hey, we saw these problems at your site. You need to take action and correct these problems. And OSHA has been issuing a lot of these notification letters to companies. So it's not a citation, it's just a heads up letter. So if we see COVID problems on the site, we can issue these notification letters to the company. The thing about notification letters is that I've heard some companies complain about is they have no recourse against those letters. You know, they can't contest the letter or come to an informal conference and talk about a letter. That's one of the things employers have been complaining about is once they get a letter, they get a letter. There's no recourse for them to get out of the letter or have the letter rescinded or anything like that. So just keep that in mind. It's not a citation. It's just a, hey, we saw some problems and we're sending you a letter to let you know about those problems. Okay. So in a nutshell, with this NEP, construction NAAQS codes are considered to be in the appendices, could be put on an inspection list, but the area director has the ability to delete those NAAQS codes from the list so you never show up. But if we're out there on a fall or a trench or some other complaint even, and we see COVID hazards on the work site, we can address those and send the company notification letters regarding the problems. Now, these NEP inspections, these programmed inspections off this list, they take a back seat to all of our other stuff, okay? Our fatalities and catastrophe inspections that we're doing, complaints, referrals, follow-ups, we're doing all of those types of inspections before we do these NEPs. So these NEPs are kind of like the last priority over all these other types of inspections that we're doing. If you're in a SHARP program with BWC or a VPP, then you're probably going to be exempt from any NEP inspections for COVID, because if you're in SHARP or VPP, you're working with BWC, you're working with us, you've got an excellent health and safety program. We probably don't need to worry about COVID in your workplace. Let me go back here. So they talk about the general duty clause in the NEP. And for those of you that aren't familiar, general duty clause, that's what we call a 5A1 violation. 5A1 violations when we issue a citation to companies where we don't have a regulation for it, but we have industry recognition or we have company recognition of the hazard. So there's not a law in the books, but it's still a problem. We can issue 5A1 citations. We haven't issued any 5A1 citations for COVID in Region 5. I'm not even aware of any 5A1 citations issued in the United States for COVID. So even though the NEP talks about 5A1 general duty clause violations for COVID hazards, the bar for that is really high, and it's very hard for us to substantiate a 5A1 citation for COVID. Not to say that it's impossible, but it's really hard. So don't let the 5A1 general duty clause violation thing in the NEP freaking you guys out and thinking that if we roll up on a site and we see two guys working next to each other with no face masks, that we're automatically going to issue a 5A1 citation against you, because that's highly unlikely. At the most, you're probably going to get a notification letter. This is just kind of like our inspection procedures. We're going to verify if you get put on an NEP list and for some reason we show up at your construction site, which is highly unlikely. I'm not going to say anything's impossible, but first thing we're going to do is just verify your NAAQS code to make sure you're even not supposed to be on the list. Then we're going to determine whether your folks are doing anything that are going to put them at risk for COVID. Look at your OSHA 300 logs and so forth to see if you have any COVID related illnesses on your logs. We're going to kind of do an assessment just to gauge our exposure and to gauge your employees' exposure before we even start going out looking at things. During the opening conference, if it's determined that no work assignments are exposing employees to COVID, you don't have any cases on the logs, you don't have any lost time or hospitalizations from COVID, then we'll not proceed with the inspection. So even though your name's on the list and we somehow get out there to inspect you under this NEP, if we get out there and find that there's no COVID hazards and there's no one that's been sick, work related, no fatalities or anything, then we will back out. If we determine that workers are performing high hazard activities, like working next to someone with COVID for more than 15 minutes, not doing 6 feet of exposure, social distancing, then we proceed. I don't see this happening on construction sites. This is more along the lines of if we walk into a nursing home or something like that, where we have nurses caring for COVID positive residents and so forth. I don't see us walking onto a construction site and there's someone actively working next to someone that has COVID-19 and the employer knows it. I don't see that happening. So, and we talked about the general duty clause a little bit. Okay. So that's the NEP in a nutshell. I know I threw a lot of OSHA stuff at you there, but just to recap, construction industries are on the list, are on the NAAQS code list and can be put on an inspection list for COVID-19 inspections. I don't see that happening a lot. The area director does have discretion in removing your NAAQS codes from any inspection list. And the way you're going to get into COVID is if we're out there on a fall or a trench or a complaint and we see workers not following the governor's orders, not following CDC guidelines. And if we see that, we may ask a few extra questions and send the company a notification letter. But I don't see us changing how we're handling construction, how we've been doing over the last year on construction sites. So, you really don't have a lot to worry about under this NEP. But that's about all I got to say about the NEP. So I will open it up for any questions that you got. You probably got a few questions.
Todd, I have one. In regards to the paperwork, you talked about the 300 log. Is there any other programming documentation that they would expect to see from a contractor in regards to COVID, along with the 300 logs at the time of the evaluation?
No, because you guys won't have an infection control program like a hospital would. We probably will ask some questions. Anytime we do a construction inspection right now and for the past year, when we roll up on site, we will ask, are there any COVID positive employees working? What are you doing to protect your employees? We'll just ask those typical types of questions just to gauge our exposure and to see what you're doing to protect your employees. But there shouldn't be any more documentation asked for.
Okay.
And keep in mind, the likelihood of us coming on a construction site on an NEP inspection specifically is very, very low. I don't even know if it's going to happen. I'm not going to say it's impossible. I'm not saying it's not going to happen. I'll never say that, but the likelihood is very, very low. I think 99% of the stuff that you're going to run into from OSHA is us showing up on a fall or trench problem and us asking some questions about COVID. And if we see 3 guys standing around smoking cigarettes next to each other or whatever, and they got their masks off and they're not social distancing, we may address that with a letter or something.
Okay. Yeah, the majority of our folks in the industry, I mean, even the JTC schools, they have documented programming, posters, training. They fairly have a good process implemented. At any time, would they ask for that information?
I'm not going to say it's never going to happen because not to mention any specific CoShow names, but some compliance officers like to ask for a lot of stuff when they're on site. But it's not going to be part of our standard MO that come on site and
Yep.
ask that kind of stuff.
Very good. Now,
We'll be able to assess that just by asking the general contractor some general questions on what they're doing to protect employees on the site. I don't see us asking for a bunch of stuff. Not to say it's not going to happen.
right.
We know those CoShows, right? But that's not going to be part of our MO.
So is the NEP have any direction on multi-employer job sites? I mean, everyone on this call works on multi-employer job sites.
I
Either
don't
they're
remember it having that in there. So I went down through that thing page by page. I mean, multi-employer still kicks in. I just don't know if the NEP addressed that specifically.
okay.
If you got multi-employer job sites, the same things apply. We want to know how the general's enforcing social distancing and all those types of things with the subcontractors. But the NEP, I don't believe addresses multi-employer job sites. Now, if we come onto a multi-employer site, a big commercial job or something like that, and the COVID guidelines from CDC and the governor's executive orders are just kind of being ignored, and we see people not social distancing, not wearing face coverings, and so forth, maybe we do issue multiple notification letters. We'll probably issue a notification letter to the general and then that subcontractor who we have guys exposed to. But it's like I said, we haven't issued any citations to the construction contractors in the last year in Region 5. Now we've gone out on complaints and stuff like that. We've probably handled some non-formal complaints to contractors, but no citations been issued that I've seen.
So another common question that I get, Todd, is what if the state of Ohio opens up and we're somewhat back to normal with no face coverings and restaurants are opening and the NEP is still in effect? Because you said the NEP is effective for a year, in
Yeah.
effect for a year. Any recommendation or comments in regards to state law opening up compared to federal NEP?
Well, let me back. So the NEP is effective for a year, but they can cancel it sooner if they want to. And they can also extend it if COVID doesn't go away and becomes more of a problem, or there's a variant that comes out or something else. So it can't be canceled earlier. But as far as state law versus CDC, like state law may be in contradiction to CDC guidelines, which are federal, and in that case, where we have state law that says, you don't have to do this stuff. I don't see us violating what the governor's saying and making you guys go above and beyond that with this NEP. Okay. Now, where we run into problems is with this emergency temporary standard that they're talking about. This COVID regulation that they're talking about. This emergency temporary COVID standard is what I think official name is. They're still working on this thing in Washington. Okay. We don't know if they're going to put it out or if it's just something that they may be working on. We don't know what's happening with it. It may come out, it may not, right? And if the emergency temporary standard does come out, that's a federal regulation. That's going to trump anything that the governor says. And I'm thinking about Texas specifically, right? That opened up. That's a federal OSHA state. So if this emergency temporary standard that comes out and it says, well, you got to wear face coverings in the workplace at a minimum, you got to follow these guidelines or these regulations in the workplace, and then that would be something that those industries would have to follow because that's a federal requirement. So that would trump anything that the state says. So right now we don't have that. So if Ohio opens up and they say, well, face masks are a thing of the past, or they relax some of the regulations, then we'll keep an eye on those. We're not going to make you follow two sets of rule books. But if there's a regulation that comes out that we can enforce, that regulation is going to trump anything else. So keep an eye on that COVID regulation, which may or may not come out. We don't know yet. It's developed. It's sitting there. It's ready to be launched, but we just don't know if they're going to pull the trigger on it or
Yeah, we appreciate that insight. Just for those of you who don't recall, Todd sits on the regional COVID panel, or is that the correct title for that committee?
not. Yeah, close enough.
Yeah, and he sees all COVID citations coming through the region. So we definitely appreciate that insight. Todd, one more question. Does the NEP address anything in regards to vaccinations and COVID testing?
No,
Okay.
no. No, it doesn't. It doesn't do that at all. The only thing the NEP addresses is how to form our inspection list, what industries are going to be targeted, and then how we go about doing those inspections. It doesn't say anything about the vaccination. So, as vaccination rates go up, the COVID's going to go down. We've already seen, we haven't had any healthcare related fatalities in the last couple of weeks in Region 5, so that's on the downward trend. And typically we're getting 10 to 15 healthcare related fatalities every 2 weeks. And we haven't seen anything like that. So the COVID fatalities and hospitalizations are definitely going down. They're heading in the right direction. Now, infection rates are going up in some states, but those hospitalizations, fatalities are going down. So hopefully it keeps going that direction. But yeah, if they issue this COVID regulation, first thing I'm going to do is get a hold of you, Ken. We're going to get on here and educate your members on it before it even
Okay.
hits the street. So maybe we can have an emergency meeting or something like that, or I shouldn't say emergency, but maybe a less than scheduled meeting.
Right. We appreciate that.
Yeah, we'll definitely get with the members probably within a day or two of that thing coming out, and we'll get on here and we'll educate everybody on that. I haven't seen it. They've been keeping it under tight wraps. Our folks in Chicago have seen it, but for some reason they're not letting anybody else see it. But I've been told that if you're following CDC guidelines as far as the distancing and doing the health checks and face coverings and so forth for construction, if you're following those CDC guidelines, you're complying with probably 90% of it already. So whatever does come out won't be a huge burden on employers to comply with in the construction industry.
Good. Thank you, Todd. Does anyone have any questions for Todd in regards to his update? No questions. All right, let me.
If you got any questions, send them to you, Kent, and forward them to me, and we'll answer whatever we can answer.
I got one real quick, guys. Todd, I think there were some requirements for employers to educate their employees on common misconceptions and fact versus fiction, a bunch of stuff like that. I forwarded a bunch of that stuff and printed out copies by our sign-in sheet and whatnot. I mean, any other guidance on our duty to educate our employees?
No, there has been no guidance on that. Even when we go into healthcare and stuff, we most employers are educating their employees on COVID-19 and what the company policies are for distancing and face coverings and stuff like that. I know we haven't issued any citations on informing employees. Okay. 97% of the citations that we're issuing over the last year have been respirator violations for folks getting put in N95s without, a respirator program and stuff like that. So we haven't even been issuing very many PPE citations in general industry. So yeah, it's a good thing that they keep informing their employees on the COVID hazards and what the latest and greatest guidelines are from CDC and the governor's orders. But there's no requirement under the OSHA regs that require that. Definitely keep doing it.
Okay. One last question. Any guidance on double layered face coverings?
No, I think there is
that can be a requirement. I guess let me be more specific. Do you see that as being mandated as a requirement?
No, I don't see it as a requirement being mandated. I know there's some CDC guidelines out there that talk about double masking And we talk about double masking, we're not talking an N95 with the face covering over it. We're talking 2 face coverings, either 2 cloth face coverings or cloth face covering with a surgical mask over it. That's what they're talking about. So there is some CDC stuff out there that's saying that that is effective in preventing the virus coming from the user to somebody else, but it also prevents some sort of minor protection to the user about virus getting in. So there is some CDC stuff out there on double masking, but nothing OSHA is really looking at.
Okay, thank you.
And just to remind everyone, I shared the screen so you can see the COVID resource for our contractors. We have our industry guidance memo, and we also have a CEA company template that is a Word document, and it incorporates as this thing goes. I don't know if you guys can see this or not. Let me see if my screen's sharing it correctly. It's not. Hold on. We keep it updated with the CDC recommendations, and just a couple things I want to show you. To Tom's point, we do have a standard template. Are we seeing it? Okay, but at the
Yeah.
back end of the template, we have in the middle of the document we have screening questions that were recommended by OSHA off their website. We have hazard assessments that's recommended off of OSHA's website, incorporated into the program. And then we scroll down here and we have the oops, I lost it. Sorry, gang. We have the and I lost you too. Hold on. There we go. We also added, Tom, to your point, a toolbox talk. These are all posters and toolbox talks we added to the program. And we also added just recently a FAQ about the COVID vaccination that came off the CDC, and also a template letter that the CDC recommends we share with our employees in regards to the vaccination. So if y'all haven't seen this, we have that as attachments on our website, ceacisp.org, and then the COVID site that's open for everyone to take a look at. So Todd, that's just something we have in place for our folks, and then we reference the CDC website as well and within the document to help them look for that information for education. So Tom, I don't know if that helps or not, but it's that letter is directed by a CEO or president to the employees of the company.
Yeah, if you follow CDC, you're not going to go wrong with us. I mean, daily when we're screening these COVID cases at these nursing homes and hospitals and so forth, and we're always referring back to CDC guidelines. You know, that what's the CDC about this, or what do they say about that? So, because we run into all kinds of crazy stuff. So yeah, that's a good document you got there, Ken.
Thank you. And Todd, if you don't mind, keep us posted on those citations as they go through COVID. We'd be curious to see. I know there's a couple of fatalities you said in the region we were following closely. So as those proceed, any updates would be much appreciated.
Yeah, there's actually a lot of fatalities with COVID. I'd say 100% of them are in healthcare.
Very good. Okay, I'm going to stop recording here.